If something feels wrong, trust your instincts and seek the help and support you need. Welcome to Fourth Trimester Voices, the podcast where we delve deep into the fourth trimester. I'm your host, Dr. Choa. I want to tell you a story about one of my patients who we will call Sarah. Sarah was a second-time mom who had a very difficult postpartum course. Her first pregnancy ended up being a C-section, and it was difficult, but she was able to push through, and her husband decided to have baby number 2. The reason I'm telling you about Sarah's story is I want to highlight the importance of self-advocacy and the impact that it can have on your well-being and your recovery. So Sarah had a normal second pregnancy. However, her childbirth was complicated. The baby refused to come out. She had a very prolonged labor and ended up requiring a C-section to birth a beautiful baby boy. The C-section itself was long and complicated from what she reported. She states that the doctor said there was a lot of bleeding and there was a lot of unexpected scar tissue around the area. And so things just took a little bit longer. But baby was born and she was discharged home after a couple of days with some pain medication. She initially reported the typical exhaustion that comes with having a baby and the typical learning curve that ensued as a result. But what she began to notice is that after a couple of days, her abdominal pain was different. It wasn't the same as the abdominal pain from her C-section before. This was more intense, more severe. If she walked, she would get severe pain. If she went to lie flat, she would get severe pain. If she sat in a car, the pain would be more severe. She had had a C-section in the past before, so pain was not unusual, but this particular pain was very unusual. So she decided to call the on-call doctor and was transferred to a nurse. And she told the nurse that she was having a lot of pain around her incision and she was requiring some pain medication. The nurse reassured her and said that pain after a C-section was normal and just to take the Percocet that she was prescribed. And if things get worse, to call back, or she should just follow up with her doctor at the 2-week postoperative appointment. Sarah recognized as the next 24 to 48 hours progressed that things were not improving. She decided to advocate for herself. She called the on-call doctor the next day and said, listen, something is wrong. This does not seem normal. I've had a C-section before, but this pain is very intense. So between her and the nurse, they decided to send her to a nearby emergency department. And this is where I met Sarah. I saw Sarah in the emergency department. Sarah looked frightened. See, Sarah is a Black woman, and I took one look at her, and I saw the fear that she had in her face. And I understood where that fear came from. She was not just scared that maybe something was wrong. She was scared that something was terribly wrong and that she would become a statistic and that she would die. She did not have to say much of anything that day. I comprehended everything she was saying without her using her voice. I evaluated Sarah. I felt her stomach. And for me, her exam also seemed atypical. I then got a CAT scan of her belly. And what we found was that Sarah had a post-surgical complication, a complication that did not require surgery, but mere trending of her blood levels and required additional pain medication to get through the rough patch. So she had internal bleeding, which probably occurred during the C-section. And so she had an abnormal amount of bleeding in her abdomen that was just causing a lot of discomfort. So what we ended up doing is trending her hemoglobins to just make sure there wasn't any additional bleeding. But at that moment, we realized that her pain wasn't usual because she had bleeding in her belly. And so that was causing her to have an additional level of pain, which required stronger pain medication and just required some closer monitoring as well as reassurance. Her symptoms were not normal. Her pain was not normal. And she understood her body and she decided to not settle for what the nurse said, but to call back and to insist that she required evaluation. The additional tests revealed what the cause of her pain was, and this allowed her to have additional monitoring and treatment. I'm telling you the story because Sarah's story is a testament of the power of self-advocacy. By educating herself and properly communicating her concerns and insisting on appropriate care, she was able to address her health issues effectively. Sarah's experience shows that while the postpartum period can bring unexpected challenges, advocating for yourself is crucial. If something feels wrong, trust your instincts and seek the help and support you need. Whether it's a physical issue, whether it's a mental health concern, your well-being matters. Patient advocacy is really about ensuring that you, as a patient, have a voice in your healthcare. It means having the information, the support, and the confidence that you need to make an informed decision about your care. The fourth trimester is a critical time, and advocacy is important. You need to arm yourself with self-advocacy because new moms are often advocating a lot of different challenges. You're navigating the physical changes that you're going through, the emotional changes, the psychological changes. So you need to be able to be in tune with how you're feeling, to know yourself, and to be able to voice your concerns when challenges come up. I'm going to talk about the benefits of self-advocacy. By advocating for yourself, you are ensuring that you are getting the care that is tailored to your specific needs. So you're getting personalized care. This can mean getting the right treatment for you, receiving adequate support for your mental health issues, so for you, and ensuring that your preferences and your concerns are respected. Because let's face it, we can have as many books that teach us how to treat X, Y, and Z. We can see as many different conditions that say this is how you treat X, Y, and Z, but you are different. Whereas somebody may have a headache, may have visual complaints when they have preeclampsia, you may not have any symptoms. You may just have a feeling of doom that something is wrong. You may just have severe fatigue. So taking the time to treat you as an individual is important because you know yourself. And so this is where self-advocacy comes up. We are no longer going to treat you like the textbook or like how X, Y, and Z presents because you're different. And so unless you advocate for yourself and say, listen, I don't go by the textbook. My symptoms are X, Y, and Z. Your doctor may not know that something is wrong. So this is important. Number one, self-advocacy is important because of that personalized care. Number two, self-advocacy is important because self-advocacy leads to better health outcomes. There are multiple studies out there that show that patients who are active participants in their healthcare often have better outcomes. They're more likely to receive timely care, they're more likely to receive appropriate treatments, and are less likely to experience medical errors and oversights. I have some of my patients who call me just to actually ask me just for advice. Hey, my doctor is recommending X, Y, and Z. What are your thoughts about this? I pulled up some articles that say this. Do you think that this is what I should be doing? Do you think that this is proper, knowing my history? Those conversations are super important because maybe the person who's taking care of you doesn't have a context. They may not know how your last 3 pregnancies have gone. They may not know how you presented when you had a heart attack. And so really advocating for yourself and advocating for appropriate treatments and asking questions leads to better health outcomes because now you have a doctor who is engaged, who is treating you as an individual, who can have conversations that make sense for you that may lead to better health outcomes. Have you checked our maternal mortality statistics lately? We do not have the luxury not to advocate for ourselves. Black women, if you're listening, you do not have the luxury to not advocate for yourself. You need to advocate for individualized care. You need to advocate for yourself. You need to ask the questions. You need to be aware of your health concerns. You need to make sure that you are engaging your healthcare provider so that you have better health outcomes and you do not become a statistic. And thirdly, advocating for yourself is empowering. It's going to build your confidence. It's going to help you feel in control of your health and well-being. Have you ever had a doctor or somebody make a decision on your behalf and you just do it? But then after the fact, you feel like, man, I just wish I had asked more questions. Man, I don't know if I needed that. Right? You felt like you were not in control. So if you practice being an advocate for yourself, you will feel that the decisions that are being made on your body, on your care, that you are part of those decisions, that somebody is not just telling you what to do, but you are consenting. You are making an informed decision. And in turn, that's going to give you a confidence booster and it's going to empower you to speak up even more in the future. So I know I'm sitting here and I'm talking about advocate for yourself and do all of this, but the reality of it is that a lot of moms can't advocate for themselves, right? Some of us have the luxury where self-advocacy comes easy, but there are a lot of moms out there who feel that they don't have a voice, who feel that they have to do these things that their doctor is telling them to do or their healthcare provider is telling them to do. A lot of the barriers that exist that I can see that exist in patients advocating for themselves is number one, lack of information. And a lot of new moms, they feel that they don't have a lot of information out there. And really, it may not even be a feeling. They just may not have a lot of information out there. I always preach about how I had to find out about lactation consultants. I had to find out about pelvic floor therapy. I had to persist and talk about my mental health state until I was able to get the help that I needed, right? I felt like there was a lot of information that I just didn't have. And I'm a whole provider, I'm a whole doctor. So, how much more the mom who just had a baby? So, there's all this information out there talking about what to expect when you're pregnant, but there's not a lot of information that talks about what to expect in the postpartum period. So, a lot of moms don't even know to advocate for themselves because they just don't know what to expect. And this is part of the reason I'm even doing this podcast is because I want to educate you on what you should be expecting in the fourth trimester in hopes that you'll have the information that you need so that you can advocate for your health. Without knowledge, it's really going to be challenging to recognize when something is wrong or to know what questions to ask. So one of the barriers, lack of information. Another barrier is the power imbalance, right? Traditionally, the doctor has all the say, and then the patient does what the doctor says, right? This is how, in history, this is how medicine started. Obviously, the tide is changing and people are becoming more informed. There's a lot of joint decision making between doctors and patients, but in a lot of practices, even still, or even in the healthcare system, you do find that there's this provider-patient dynamic that sometimes can feel really imbalanced. It's like an imbalance of powers, so that a lot of patients are just scared, or they're hesitant to ask questions, or they're hesitant to cast doubts or ask questions or express their concerns. And let's just face it, a lot of people just don't trust their doctor. I come across a lot of patients in the emergency department, and I hear about my doctor doesn't listen to me. My doctor just gave me this, and they just don't have a great relationship with their provider. And so it just leads to this inability to advocate for their needs or even just express and say, hey, I'm having this issue, because they may feel that they're going to be dismissed. Another barrier to self-advocacy, in particular with postpartum moms, is just the emotional and physical exhaustion. The postpartum period is exhausting, both physically, emotionally, and this can really drain all the energy and make it difficult to resolve. Can make it very difficult to find resolve to advocate for yourself. I'm just tired. I just can't. I'm tired of fighting. I told my doctor I wasn't feeling good, and she says this is normal, and it's normal. I'm tired. Let me just rest. I don't know if that sounds like you, but it's easy to get into the state where it's like, I'm physically, emotionally exhausted. Therefore, I don't even want to deal with this right now. And the last barrier that I want to talk about is just socioeconomic dynamics. So feeling like I'm getting what I'm getting because I may not make as much money, or I carry this type of insurance, or I'm low income. So this is the care that I'm paying for. So this is the care that I deserve. Lack of family support, right? There's nobody available here to help me watch my kids so that I may go to the doctors and get the care that I need. There's nobody here to support me. There's nobody here to bounce off these questions with. So that lack of support can really make people feel that they just can't voice their concerns when it comes to advocating for themselves. How do you recognize that this is the moment that I need to advocate for myself? When do I know that I need to stand up for myself and say, hey, this is not normal for me? I would say that number one is you need to arm yourself with the knowledge. You really need to understand what the common postpartum challenges are that exist. So the physical issues, right? What are regular aches and pains, the back pain? When is it abnormal to have back pain, right? Is it normal to have shooting pain down my leg? Is it normal for my leg to go numb? So understanding what is normal in terms of the changes in your body and what is abnormal. You want to really listen to your body when it comes to this. You have to understand when something is off and have a good sense of understanding when some symptom does not seem regular. For example, ask questions about what a level of bleeding is significant, right? Is it just soaking a pad? Have these conversations with your doctor. You have to understand what are signs of infection. What is the expected and unexpected recovery time from childbirth? You want to also arm yourself with the knowledge about what are common mental health challenges, including postpartum depression, postpartum anxiety. You want to arm yourself with knowledge about breastfeeding, right? So navigating breastfeeding or formula feeding, what is normal sleep deprivation, what is normal care for yourself or the baby. So you want to be able to, number one, arm yourself with the knowledge, basic knowledge about what postpartum looks like. If you're not sure where to start with this podcast and you can go from there. You can also follow my page. Sometimes I do post about a lot of postpartum complications that you should look for. What are signs that you may need more support? If you're feeling unheard, if you're feeling dismissed by a healthcare provider, if you're experiencing persistent health issues without clear solutions or support, if you're needing more information or resources to make an informed decision about your care, these are signs that you may need more support. So how can you get this more support? Where do you even start? Number one, educate yourself. Learn about the postpartum because knowledge is power. Number two, you want to communicate clearly. Communicate clearly with your provider. Be direct, be honest about everything, your concerns, your symptoms, your need. If you can't communicate clearly to your doctor, you want to communicate clearly to somebody in your circle, your family member, your doula. If you have anybody in your birth network, some friends, communicate to them what you are going through so that they may be able to advocate for yourself as well. You want to ask questions. Don't hesitate to ask for explanations, second opinions if something does not feel right. Bring support. Bring your partner, bring your friend, bring your family member to that appointment, right? Because you need the moral support so that you can confidently ask questions and document everything. Write everything down before you go. Everything, because let's face it, we have a lot that we are worrying about on a daily basis. And so oftentimes, by the time you get to the doctor's office, you forgot about those 10 complaints that you had during the week. And only until you leave the doctor's office do you remember this. And at that point, they're asking you to make another appointment. So really document your symptoms, write everything down before you go so that you may be able to concisely communicate your needs clearly to your doctor. So you may be listening to this and you may not be a mom. You may be a husband listening. You may be a birth worker. You may be a family member and you're asking, How can I support my family member? And how can I support them if they don't even know that they need the support? Like, what do I do? Number one, you want to listen to their experiences without judgment. Ask them how they're feeling. Ask them how you can help them. Encourage them to speak up and share their concerns with their healthcare provider. Encourage them to journal and write down what's going on with them. If you can't reach them in this way, just drop resources and information to them that may be helpful. Hey, I found this article about X, Y, and Z. Hey, there's a support group that I thought you would, benefit from seeing. Hey, there's this program that you can do. Hey, there's this community that you may benefit from. Help build a community around them. Rally your friends who can come and check on her every once in a while. Rally some people to cook some meals for her. Make her feel supported so that she may be able to communicate and share with you what she's feeling. So what role does the healthcare provider have in all of this? When you're making a decision about your doctor, before you enter a relationship with a healthcare provider, you need to make sure that you are getting compassion, respect, and non-judgmental care. You want to make sure that you can clearly communicate with this person and that every time you interact with them, that you are sharing in the decision-making process, that things are not being forced upon you, that you are having a conversation or dialogue and you're making decisions together. You want to make sure that this doctor has access to resources and referrals. If they're unable to support you, that they can refer you to somebody else. So how can EM Care to You help? Or how does EM Care to You help? EM Care to You in the Atlanta area offers personalized postpartum care and support. Not only do we provide that primary care that a mom needs after they give birth, we also provide urgent care that mom needs after she gives birth, but we have resources and advocacy that is critical during the fourth trimester. And all these resources, the support, really help mom navigate the fourth trimester with confidence. So if you happen to be in Atlanta, give me a call. I want to leave you with a few things and some encouragement, maybe some empowerment. You are your best advocate. Trust your instincts. The textbook may say one thing, but you know your body. You spent however many years in your body. So trust your instincts. Seek the support that you need and know that you're not alone. If you're looking for more personalized support, keep looking, keep searching, ask your friends. See who can be a good fit to you. Getting comprehensive postpartum care and advocacy is really important in helping you thrive in the fourth trimester. So you want to make sure that you are building this support network before and during pregnancy. I really hope you enjoyed today's episode. Please subscribe, leave a review, and really share this information with other moms. We don't have time to not advocate for ourselves. Thank you for joining us on this episode of Fourth Trimester Voices. If you have any questions about today's episode or you want to share your story, please email us at fourthtrimestervoices@gmail.com. My name is Dr. Choa, and it's been lovely talking with you all today. Take care.